I invite Dr. Patrick Kuma Abuaji, the Director General of the Ghana Health Service, to give us today's first brief on the situation of COVID outbreak in Ghana, and also give us some insight into Ghana's recovery protocols and an update on recoveries, if any. Dr. Abuaji.
Thank you very much, Honorable Minister. Honorable Deputy Minister, Energy and Information. Between the 16th and 17th May, the country has recorded 183 confirmed cases from 6 regions of the country, which means that 10 regions did not report any case during that period. Greater Accra contributed 108 new cases, and almost half of these cases were from Accra Metro, Korle Klottey, Ayawaso West, and 12, and which had also reported 12. That tells you that the number of districts reporting huge numbers in Greater Accra has continued to come down. Ashanti region recorded about 63 new cases, and 90% of them came from Accra Metro. Kumasi Metro reported 19, and Obuasi reported 38 cases. Volta region reported 7 new cases, mainly from about 4 districts who had 1. Hohoi represented 3, Pandu 1, Akachi 1, and Ketu South also showed 1. Central region reported 2 new cases. Oti reported 2 new cases. Eastern region reported 1 new case, and all the other regions reported no case. We have a total of 1,754 recoveries as we speak now. The rest of the cases are well and responding to treatment. 5 of them can be classified as critically ill, but nobody is yet on ventilator, which means that it's probably not life-threatening. We have so far recorded a total of 31 deaths across the country. The last time we gave an update, and we believe that we will be able to do the next time. The next time we'll do more updates on the deaths in probably the next briefing. Yes, so the next slide is just a breakdown of exactly what I have said, which shows the maps, the number of cumulative positives across the country, and then a total of 183. So it shows you exactly where the cases have come from. Western and Western North, who were reporting cases of late, have also stopped reporting cases. The next slide will show you how the distribution of our cases among districts across the country. So you can see that Savannah, Bono East, and other places, Ahafo has no case yet. Bono has only reported 1 imported case. Ashanti is concentrated mainly in Kumasi and its environs and Obuasi. Eastern region is in the lower Menya based on the camp and a few sporadic cases in a few districts. Western is located in the Takoradi area. And the Central region has a high-dose caseload in Elmina, which we are looking at. And of course, Greater Accra carries the largest burden, mainly in the Accra Metro and its environments. You see that if you go to the next slide, you can see for Greater Accra, I'm just concentrating on the 2 main regions that provide more the cases. Greater Accra, you can see that it's all Adan East, Adan West, Shai Oshidoku, Ningo Pram Pram. So far, nothing happening there. But we have them in Accra Metro and the district that have been mentioned, that has been displayed on the board. If you go to the next slide, which is Ashanti region, you can see that the concentration is mainly in Kumasi and its environs, and then you have the Obuasi come up. We have a few sporadic cases in Santachim and Adansi South area. I think we've been talking a lot about recoveries. So the next slide will give us a bit insight on recoveries, how we say in Africa. The total case reported in Africa from the last time we checked showed about 89,000 cases in Africa and 38.8% recoveries. You have the Ghana ranks quite low. We have 29.6% recoveries, but we have countries with 44.4% recoveries. Obviously, there are different parameters that are used in measuring this. Next slide. You have you can go to the next slide, the same repeat slide. You can also have for West Africa, in terms of the ranking, you can see not necessarily in ranking, Ghana has 29.6%, but we have Niger with 77.2%. We also need to look at the number of cases. Now, when it comes to the recoveries, as I've been saying, when someone is ill, if you do not die, the life course or the nature of the disease, within 3 weeks, you'll recover. And I'm sure most of us have the experience. So from the beginning, when we have 1, 2, 3, you are not expecting any major recoveries in the first 1 month. After which, they will come. But as you have more cases, 3 weeks later, you should expect more cases recovering. And so that's why you're having an exponential increase in the number of cases. If you go to the regional breakdown, you see that Ahafo, of course, they have no case, so they have no recovery. Ashanti has had 213 recoveries, and that's about 24%. Central region has had, after the 212 total cases, they have 40 recoveries. Greater Accra has 22% recoveries. Northeast had 2 cases. 1 died, and the other one has recovered. So one can say that now Northeast has no case to deal with. OT has 38.7%. Savannah, among others. Western region has had 8 recovered because their cases started quite late. And so we expect that it took a while before we start getting their recoveries coming up. And those are the treatment centers. The information we have so far, as of yesterday, is about 325 of them who have come treated and gotten virus-free and discharged. So those are some of the key issues. And the recoveries, now that the numbers are down, the labs have the opportunity to do more tests and also do the follow-up tests to ensure that we have more recoveries. And I'm sure when Dr. Queen talks about TEMA, we'll have more information about impending recovery. So thank you very much, Honorable Minister.
Thank you very much, Director General, Ghana Health Service, Dr. Patrick Kuma Abuaji. So, ladies and gentlemen, we are informed that as of this morning, Ghana has seen some marginal increases in our positive cases between the 16th and the 17th, 183 new cases between the 16th and the 17th. We are informed that there are no new cases in 10 out of the 16 regions. So our total case count marginally rises to 5,918 5,918. There have been 1,754 recoveries. The regional breakdowns of the recoveries have also been provided. We have 5 persons who are ill, moderately and/or critically, and we have lost 31 of our compatriots. Our condolences to their families, our thoughts and prayers remain with them. But to be able to continue on the trajectory of getting no new cases in even more regions, we need to continue to pay attention to the drivers of transmission of COVID-19. We are informed that crowds are one of the drivers of the transmissions. The rate of spread of the virus is known to be expedited in crowded environments. This occurs when an infected person coughs, sneezes, cries, sings or talks, and droplets from the mouth or nose are launched into the air and inhaled by people. And so let's be advised when we get into such crowd situations. Again, another driver of the transmission is close physical contact. We are told that close proximity, that is within 2 meters of an infected person, increases our risk of getting infected. Prolonged stay in an enclosed environment causes a higher saturation of the virus in the air, increasing the risk of transmission. Confined spaces with limited natural ventilation increase risk of spread of the virus. So let's be wary, those of us who enter into offices and the air conditions are on, the windows are closed, the blinds are drawn, and we are in the air condition and we are speaking, we should be guided that such confined spaces with poor ventilation or fresh ventilation pose a threat, and that the duration we stay in those conditions can increase the probability of our getting infected. Touching infected surfaces or objects and then touching mouth, nose, or eyes is known. COVID-19 is known to live for hours or days on a surface depending on the factors such as light and humidity. So we should be careful about touching surfaces and touching our mouths, our noses, and our eyes. Older persons and people of age with underlying medical conditions, heart attacks, diabetes, liver, and asthma are at a higher risk of severe illness or death from COVID-19. Please, let's pay attention to these ones. Whilst we go out there to visit our aged, whilst we interact with them, we must know that they are a high-risk category of persons, and we should be careful about how we interact with them. And for our elderly, the advice is that when you show symptoms, please immediately make the call to the emergency numbers and the COVID numbers for assistance. For the elderly and for persons who have underlying health conditions, it's important that immediately you feel unwell, you make contact for assistance. So, ladies and gentlemen, we are proceeding with the briefing. At the last briefing, we were informed that the Director General of the Ghana Health Service led a high-powered delegation to Obuasi, and also another team was dispatched to Tema to conduct surveys and understand the situation in the 2 communities, Obuasi and Tema. I shall invite Dr. Franklin Asedu-Bekwin, Head of Disease Surveillance, to give us an update on the situation in Obuasi and Tema. Dr. Franklin. And please use the hand sanitizer.
Good morning, Honorable Minister, Honorable Deputy Ministers, ladies and gentlemen. I'm here to give an update of the situation as it pertains to two main areas. One is Obuasi, and the other is a factory in Tema. Let me say that Ghana, as we speak now, has two main high-burden cities or regions. So that is Ashanti region and Greater Accra. But if you look at the trajectory of the outbreak over a period of time, there have been significant events that occurred 2 weeks ago. But some of these events actually predated the reports from the lab. And that was the context in which we had these situations in Obuasi and Tema. So I would like to say that as I speak now, Obuasi is actually the main hotspot for Ashanti region. And there's a clear focus to see how best we can address the challenge. So in that context, a high probability team led by the Director General of Ghana Health Service went to Obuasi to look at the situation on the ground. What are the predisposing factors? And then to make recommendations. But it must be said that Obuasi is actually very active, with a lot of collaboration being undertaken by Anglo Gold Ashanti, the Municipal Assembly, and other relevant stakeholders. So, please, can I have the slide? And let me say that Ghana's first two cases actually were reported on the 12th of March. The next day is the 13th. That's when we had the Obuasi case. And if you look at this slide, you can see that Obuasi remained quiet until about 2 weeks. And then this first case, which is the index case in Obuasi, Obuasi was quiet until 29th of March, then he had a second case. So we have two cases running through the town. And then we started the enhanced contact tracing. So we started getting a few cases. But if you look at this slide, it clearly tells you that it is not very extraordinary to get cases of, let's say, around less than 10 or 20 in a place like Obuasi. Until we had a case of one citizen that had come from Hohoi, and he is actually a trader who trades in the central market in Obuasi, a very densely populated community. So this person who has been unwell actually infected quite a number of persons. In total, that trader actually infected 17 persons. So you can see that from the 20th or 21st, the trajectory of events in Obuasi changed. And you can actually ascertain that 72% of the cases in Obuasi occurred between April 21st to April 25th. Then, after that, you see that there's a bit of quietness. And then we enter into May, and they have a bit of spikes. But why the February that occurred? The issue was that, as of last week, that was the time that we had the influx of the lab results. So these are events that had occurred, but there were no evidence of it by lab results. So this slide tells you about when the events occurred. So in trying to look at this slide, there are two things happening. So you can actually break down Obuasi into two sections. That is the new cases and the old cases, where the reference is made. So in trying to have an intervention, we look at where is the case. Is it the old case or new case? And let me say that Obuasi is one area that has a lot of population. So the population density is very high. It's one area that, though Anglo Gold Ashanti has a prominent hospital, but they don't have a treatment facility. So Obuasi does not have a treatment facility. Then you also see that, I mean, when we went there, though it was a casual survey, one thing which was obvious was that you do not see people wearing face masks. So it tells you clearly that there's a challenge about how they prevent disease in Obuasi. Then they also do not have a quarantine facility. So if you have a community that has such high numbers of persons who are infected, and there's no place for them to kind of to hold, then it predisposes you to the high rate of infection that pertains to Obuasi. So I want to put on record that apparently Obuasi is working as a joint community. They have the Obuasi Municipal and Obuasi East. For this outbreak, they are joint. So it's jointed at the level of the assembly, it's jointed at the level of even the health sector. So there's a bit of collaboration in that perspective. They even have what they call the COVID-19 center. It's actually a control room put in place by Anglo-Good Ashanti. So coordination purposes, they have that facility in place. And you can see that from their records, there's a lot of activities that are taking place before the spike. But let me say that I think the late release of the results took them by surprise. So they had a clear, structured system, but were not aware that they have this quantum of disease sitting in that community. So how do they hope to address this spike or this magnitude of disease in Obuasi? What they've done is that they've tried to incorporate the surrounding districts. So they have Adansi South, so Adansi Asukwa, and Adansi North. So these are districts that have come to bring their expertise and their numbers to bear on Obuasi. So for this response, we have a combination of Obuasi, Adansi Asukwa, and Adansi North. They are all together to address the challenge or the magnitude of the disease. And as I said, because we are breaking Obuasi into two perspectives, the first perspective, which is the older one, what we are doing is that we are testing or retesting all of them, because those are old cases, so they are no more, you cannot classify them as positive cases. So what we want to know is that, what is their current status? So we don't need to isolate them. So we're going to retest of them, which are started. And then we're going to carry out enhanced contact tracing in very high risk areas. Obuasi has very densely populated communities like Bahabobomi, Tutuka, Central Market, Einem, Asankore, Wawaso, Bumpe, Kunka. So these are highly densely populated communities that the focus is to see whether we can pick some positives in that community. Then we're also going to do mass voluntary testing among certain at-risk groups, including taxi drivers and food vendors. So that's by way of trying to address surveillance and contact management in Obuasi. KCCR is the main lab that does testing, but they have been under a lot of stress. Until recently, they were testing most part of northern Ghana. So you can see that accounted for the backload, that accounted for we somehow missing this magnitude of disease burden. But when we went there, they had challenges that they needed extraction kits, which DG and the ministry is trying to get it provided. And then if you look at Ghana's intervention, we initially started with swabs, but now has gone on to do sputum. So now we have a bit more of swabs now, so they are going to use swabs in addition to the sputum. Then for case management, as I said, Obuasi has no treatment center, so the plan is to have a 100-room isolation center. The idea is that they currently now have a 22-bed facility, which is actually made up of hotels, and the regional minister has actually identified a 48-room facility, which is hoping to be used as the isolation center. So in that context, they are getting close to using that 100-bed facility for isolation. Then they want to get a treatment center. Currently now they have the Obuasi Government Hospital, and what they want to do is that they want to convert the male ward into a 14-bed treatment center. So that's why they hope to address the issue about treatment. And let me say that through DG and Minister, they have gotten a facility in Kumasi, actually Azaban Egiso, that is 100-bed facility actually from NAT, so that can handle isolation cases. Then we also have the region has also a facility in TUC that can also take care of the additional cases for isolation. So that tries to suffice isolation in Obuasi. Risk communication, one thing which was obvious is that they used to have a very high momentum, which has died down because they were not seeing the cases. So the going forward is for them to mount information vans with pre-recorded messages in Twi and English that will be bled across the town. And then, as I said earlier, to actually identify and sensitize high-risk groups, including drivers, to make sure that they are all brought to bear. So that the idea of wearing masks becomes part of their way of doing things. And then they hope to engage more of organized. Let me say that when we went there, we had a meeting actually organized by the municipal chief executive, and they're brought to bear religious leaders, drivers, all together. So it tells you that they have a clear direction about how to address the spike in Obuasi. So that's my presentation on Obuasi. Let me give you a few minutes presentation on the Tema situation. The Tema one is about a factory. It's a fixed processing factory that had an employee who presented with respiratory symptoms and was actually seen by the clinic in the facility. So they took samples and was asked to go home. And then after about more than a week, the results came. So when the results came, they actually identified her contacts. And then at that time, they had 219 contacts. So there was initial tests that were done. And then to get a broader view of what is happening in the factory, that has a population. And then at that time, they had 219 contacts. There was initial tests that were done. And to get a broader view of what is happening in the factory, that has a population of 1,300. They tested everybody in the factory. So what came out was that initially it was 533, but finally it was 693 that tested positive, 695 that tested positive in the facility. So the rest were negative. So what was our approach to handling this? And the idea was immediately the factory was closed down. And then it was assessed to look at gaps that exist in such a facility. And one thing which was very obvious for such a facility, you could see that the employees were much more than the space. That was one obvious thing. The other thing was that the social or physical distancing was a challenge. Then they also have issue about, they have a canteen, and you can see that social distancing is also not being practiced in the canteen. So they have a table that 6 people sit on. So it tells you that there's so much closeness. They also have a bus that carries them around, and social distancing is also not practiced in that bus. Then they have called a turnstile. It's like before you enter the factory, you have to go through it. So it's an entity that can actually transmit infection among a group. So they also have a login system whereby you have to put your finger on. So those are all predisposing factors that can make you get the infection. So going forward, the idea is how do we look at the situation in the factory, and then how do we manage the cases and the contacts? So let me say that I speak today. For the 695 positive cases, the result that has come is that 624 are negative and 07 are positive. So it tells you that 95% of the people who were positive are now negative. So now we are trying to move the 7 to our isolation center in Pentecost facility. But let me say that these are all asymptomatic persons. And what we are doing is that if you look at these 695 persons, they were scattered across Accra. So all of them don't live in Tema. So they living in Ashama, Lojokuku, and the rest. So what we've done is that we have reallocated to their districts to identify the contacts and do the follow-up. So that's being done. But then we try to look at the factory. So what is being done at the factory? And we visited the factory to assess what measures put in place to avoid spread. And then what is very obvious is that hand wash facilities have been placed at the entrance of each section. So there's a conscious effort to ensure hand washing. Then they've tried to put floor markings The idea is to ensure physical distance. So you can see where you are supposed to stand. So there is a factory. So they tell you where to stand. You do not decide where to stand. They send their markers to ensure there's a physical presence, physical distance. Then all staff are wearing the face mask. Then hand sanitizers in place at all vantage points. Then the canteen that I said was a table that houses 6 people. Now they are housing 2. It will be required that it should be 3 because it can take 3. So they are ensuring distance now. And then they have created a holding room to handle a case of suspected COVID. So in that case, if you think that it could be a case, they will usually move there before actions are taking place. Then they've also introduced a temperature check point at the entrance of the company. So in that perspective, that the factory is ready to start operations. And I think that we communicate our findings to them, and they will have a good discussion. Thank you very much.
Thank you very much. Dr. Franklin Adom is head of disease surveillance at Ghana Health Service. We are told that for the case, the situation in Obuasi, for the old cases, an aggressive retesting of those cases are ongoing. We are also told that for the newer cases, enhanced contact tracing has resumed in those areas that Dr. Franklin spoke about, those highly populated areas that Dr. spoke about. Enhanced contact tracing is ongoing. Again, voluntary mass testing is being rolled out in Obuasi, especially for high-risk communities such as taxi and commercial drivers and so on. That is also being rolled out in Obuasi. We have been informed that extraction kits have now been presented to the KCCR, which is in Kumasi and therefore closest to Obuasi, which has been conducting the test from cases from Obuasi. The extraction kits have now been provided to KCCR. We have also been informed that the male ward of the Obuasi Government Hospital is being turned into a treatment center. These are the actions that the Ghana Health Service is taking to immediately deal with the peculiar situation in Obuasi, that the male ward of the Government Hospital in Obuasi is now being turned into the treatment center for COVID-19. A 100-bed facility has been identified and is also serving as an isolation center together with another facility in Kumasi. So the problem of isolation has also been resolved. Of course, we have been informed that public education on preventive etiquettes, such as the wearing of masks, which we continue to underscore. It is extremely important that we wear our masks. Our mask helps us to protect others. If you wear your mask, you are protecting somebody else from being infected. And when somebody else also wears his or her mask, that person is also protecting us from being infected. So you wear the mask, you protect somebody. I wear the mask, I also protect somebody. It's important that if we all wear the mask, we will protect each other and we shall cut through the rate of infestations greatly. So public education on those preventive etiquettes are being heightened on wearing of masks, washing of hands, the use of hand sanitizer, and so on and so forth. We have also been informed that in total, for the Tema factory case, a total of about 695 persons tested positive at the end of the day. Initially, we were dealing with some 533 individuals who had tested positive. At the end of the day, a total of 695 persons tested positive. Good news is that out of that 695 test results that have come so far, 624 have now tested negative, a first negative. And so, in due course, inshallah, when they test negative again, I believe that they will conform to the protocols that they can now be declared as having fully recovered. But for the records, as of now, 624 out of the 695 that tested positive in the fish factory in Tema have now tested the first negative. Only 7 out of the first cohort have tested positive. They are undergoing continuous care and treatment, and we hope that in the near future they too will test positive. Immediately the authorities moved in, the factory was closed down for assessment, and doctor gave insight to the findings. And I think that it is particularly important that we pay attention to the findings from the factory so that it can serve as an experience, a learning experience for most other companies and factories as well. Issues of overcrowding on the factory floors has come up strongly in doctors' presentation. Overcrowding definitely will make social and physical distancing impossible, if not difficult, if not impossible. And so shift systems, how we can arrange each work schedules so that we can have enough physical space to avoid overcrowding so that we can have the social and physical distancing is critical for work environment and work managers and management. We must take that into consideration. How we treat our canteens and busing of our staff has been flagged one of the potential areas. Busing of our staff, that has also been flagged. Another issue that we must pay attention to, and please, all of these are lessons that we have to learn from and put mechanisms in place to deal with them. It doesn't mean that maybe completely we should close down canteens and all. And doctor says that now, instead of 6 people sitting around the table, they are looking at about 2 or 3. So we can even have different times for different times from different groups working in the factory. All of these matters for management to consider. But one critical thing, the idea of a clock in or time scan on even an ATM machine at the bank, how we treat them is essentially important from the learning from Tema. We can continue to use our clock-in machines, we can continue to use our ATM machines, but we must treat them in a particular way so that do not become avenues for spreading COVID-19, which means that immediately before or after use of any of these, either an ATM or clock-in machine, you have to make sure that you sanitize either the machine and your hand. Is critical. If you go to the bank to withdraw your money, the learning is that it is important that the bank itself also put measures in place to deal with some of these issues. But at the personal level, you too, who before and immediately after using an ATM machine, you must also sanitize, use the hand sanitizer, or wash your hand under running water. We are also informed that remedial action has been taken by the company, and the Ghana Health Service has moved in back to do a reassessment and do re-examination, and they are convinced that now the factory has become compliant, COVID-19 compliant, with the markings on the floor and all the protocols now that they have put in place. They may become compliant, and very soon the Ghana Health Service will reach them and inform them about the way forward. So we are grateful to our colleagues at the Ghana Health Service Disease Surveillance, headed by Dr. Franklin Bedu, Dr. Franklin Asiedu Bequin, for the good work that you are doing for Mother Ghana. Ladies and gentlemen, I informed earlier that the Honorable Minister for Energy will join us with an update on some payments that the government has made to the Electricity Company of Ghana. He is here. We acknowledge his presence. In due course, we will invite the Honorable Minister to take the podium and share with us some more good news in addition to the absorption of electricity tariffs for those of us line consumers, and half of those of us who are above lifeline that His Excellency the President through the ministry is implementing. We also have the Presidential Advisor on Health. He's also joined us, Dr. and former Director General at the Ghana Health Service is also here with us, Dr. Anthony Insiasari. We are grateful for your presence. Ladies and gentlemen, stigmatization become a major concern for the government and the people of Ghana. At this briefing today, we are minded to address that important issue of stigmatization. I shall invite Dr. Wiafi Akintimbrenya, member of the Ghana Psychological Association in charge of COVID-19 stigma reduction initiatives, to help us get an understanding of how to deal with the worrying development of stigma. Dr. Wiafi Akintimbrenya, you may take the podium. Please sanitize with the hand sanitizer and Doc.
Thank you, Honorable Minister, for the opportunity. Good evening, everyone. I'm here to say on behalf of the Ghana Psychological Association to have interaction with you, especially on the issue of stigma. Since the first case of COVID-19 started, the Ghana Psychological Association, with the support of the Department of Psychology, University of Ghana, have supported the ministries, especially in providing psychological support for those who are on quarantine, waiting testing or test results, those who were tested positive to COVID-19, and while they were under care. We hope to continue to work with the ministries to provide the support. Now let me look at stigma. Stigma is a general thing that's been with society probably since Eve was added to Adam. And every society, one way or the other, have certain things they stigmatize. In general, it might be your physical appearance. It might be your social group. It might be your profession. It can be any other thing. So I want to look at one, what is stigma, on what basis do we stigmatize people, what are the effects, and what we can do. Stigma, is a Greek word that originally, and if we understand the origin, maybe we'll know why. It came out of a mark, a deep mark, that was made on an individual. Either he was a criminal, a traitor, or a thief. And the essence is to make sure that wherever he goes, people see him or her, they keep away from this person. So they were set aside, maybe the bad guys from the good guys. And since then, it has come to be part of our social life. So who is usually subject to stigma? One, as I said, may be your physique, your physical appearance. Every society has certain ideal physical appearance for males and females, for different age group. So if you don't fit in, depending on the deviation, then you may be perceived as different, having characteristics that are unacceptable and not required. It might also be part of people's, your social grouping, maybe race, maybe ethnic group, it may even be a condition of albinism or other things. The rest are also as a result of personal life or style, the way people want to live their life. Somebody wants to have a tattoo on the part of the body, but others will see that as undesirable, and on that basis, they may stigmatize them. So in general, stigma can apply to everyone, depending on your society, your age group, the subculture, and what is perceived as right or wrong. The other angle is also illness. And the fortunate and the ironic thing about this is that in our culture, that in Ghana, under no circumstance are we allowed to use people's sickness or illness, either congenital, accident, or by lifestyle, against them in any way. However, unfortunately, in this text, we use that. In the past, it has been people who are physically challenged, who are mentally, in terms of psychological challenge. It may be some form of impairment. HIV/AIDS had the same thing. And now the specific thing is on COVID-19. So why? The reason is that, as the medical people will tell us, they say it's novel. Not much is known about it. So most people put certain interpretation, the conceptions we have, the belief we have about it, that is probably as a result of a curse or sickness or certain lifestyle. So one is the misconception. The other angle is the fear that is associated with the sickness or the virus, that there's a possibility that if I get to the person, I may also contract it. And the other angle associated with it, the stigma does not affect only the person who has tested positive or who is under quarantine, but other people around him, family members, friends, co-workers. Why? Because stigma is also contagious, in quote, as other medical, communicable, or infectious diseases. That's in the thought of people, that's how they see it. And that's why they don't only avoid the person, but the family, friends, neighbors, and others. What are the effects? The effects are a lot. First, let's look at the physical. When we see such people, the extent is to label them, call their names, run away from them. That has the potential to emotionally affect the individual. It has also prevented even from getting to where others are, and that can lead to self-isolation. The other effect is that it will prevent people from reporting when they have the symptoms. And you and I know that if it is not reported, then the spread is going to increase. Stigma can also lead to discrimination of different forms. Work and services that you are entitled to. Indeed, some landlords or landladies are not likely to rent out their homes or houses to you. Your tenants may even put pressure on landlord, landlady, or even on you directly to move. And in the specific case of Ghana, we have observed about 4 issues that are somehow different from the general one that happens elsewhere and also as an academic in the literature. The first one is avoidance, as the case in Bolgatanga, and the rest. Those who are self-employed, now customers, clients, and even their own friends are telling them, don't go. So that is very, very dangerous, because one, going to affect their livelihood, and unless they move away from the town, or there's some support, or immediately we are able to reduce stigma, is going to affect them. So that is one peculiar thing we need to look at. The second thing is very unfortunate. The little girl who was stoned, or there was an attempted stoning. The question is, she was not tested positive. Why? It goes back to the case I said, it is what? Contagious. by association, and the contagious is in code. And it means that if this little girl had not been lucky, it would have been fatal as the disease